Over the last 30 years, remarkably little has been done to document the history of financial, therapeutic, and operational policy with respect to addiction and behavioral treatment. As part of our mission, C4 has developed a series of films capturing this important oral history.
I think the biggest problem is that most addiction treatment facilities are just in a state of chaos right now, that the industry is changing so rapidly and the reimbursement rates and other things are dropping so quickly that an awful lot of treatment centers are just doing everything they can to survive. And what they don't realize is if they don't have outcomes data a couple of years from now, they are not going to be in business any longer. And the other thing they don't understand is that it takes a couple of years to get that outcomes data. Because if payers want to see, what percentage of your patients at 1 year post-treatment are abstinent for at least the last 30 days, it's going to take 2 full years for us to collect that information for them.
Joanna Conti is President and CEO of Vista Research Group and Conquer Addiction in Annapolis, Maryland. At Vista Research Group, she's working to revolutionize the addiction and mental health treatment industries by providing the data treatment programs need to improve their outcomes. Conquer Addiction helps parents of kids struggling with alcohol or drugs to find the best treatment and then maintain their sobriety. Conquer Addiction reports treatment success rates to reward the centers that track them and to help rehabs continually improve.
My name is Joanna Conti, and I am CEO of Vista Research Group and also of a nonprofit called Conquer Addiction. Conquer Addiction. And the way I got interested in this field was I had a daughter who became a hardcore alcoholic. And she was drinking repeatedly to lethal levels. And I kept finding myself in the ER in a crisis situation. My daughter sometimes had been airlifted there after a car accident or something, and she would have a blood alcohol level of 0.43 or even higher. And I had to find treatment for her immediately. And each time I was forced to make what was basically a life and death decision on the basis of blind luck. Somebody had mentioned to me at some point, at a picnic or something else, oh, you ought to look into this treatment center. I've heard they're pretty good. So I'd be talking to somebody on the phone about their treatment center, and they'd be so nice. And I would say, so tell me, what's your success rate? And they would say, trust me, we're better than the rest. So we were incredibly blessed in that we always found really good treatment. And as a result of that, my daughter celebrated 6 years of sobriety this April. So she has completely turned her life around. She is the proud mother of a 4-year-old daughter. She's got a wonderful job. She and her husband have bought a house. I mean, we've been incredibly blessed. But when the worst was behind us, I was looking back and saying, I don't understand why it was so difficult for us to figure out what were the best treatment centers. So as a labor of love, I decided to create a website called Conquer Addiction that would help the families coming behind us to find the treatment centers with the best post-treatment outcomes. And I created this wonderful site in 2015 where people searching for treatment could put in all sorts of typical information. Maybe it needs to be in the Northeast. Maybe it needs to serve adolescents. Maybe it needs to take Blue Cross or whatever. And there were 2 things that were different about Conquer Addiction. One was that we didn't collect leads, let alone sell them. That's not what this was about at all. We just provided information of, here's the website, here's the phone number if you're interested in learning more about a treatment center. But the main thing that was different was that the treatment centers who were tracking their post-treatment outcomes and would report the results to us would show up at the top of the list. so that you could be confident that a treatment center was doing effective treatment. So the problem after I'd created this wonderful website was that I could find 5 treatment centers in the entire country who were tracking and would report to us their outcomes. And I said, I can't start to promote a website that promotes Karen and the 4 foundation recovery centers. So I said, well, this was disappointing. I'm just going to kind of put this on the back burner. And then I decided to go to one of the addiction treatment conferences and start talking to treatment center owners and say, why aren't you tracking your outcomes? And enough of them said, we want to do this. It's really important. It's in our next year's strategic plan. We don't have a clue how to do it. That I thought, okay, there's a business opportunity here. And I have an incredibly diverse background. I'm a chemical engineer by training. I started my career with Procter & Gamble. I have a master's in international business. I'm a serial entrepreneur. I've started half a dozen different companies in different industries. I've started international nonprofit. I've run for Congress, of all things. So, but one of the things I had done was I had taught myself how to program, and I had started and run a software company for 5 years. So I knew that this wasn't rocket science. We could figure out how to do reasonably effective and cost-effective outcomes research that the addiction treatment industry needed so much. And so I started Vista Research Group in September of 2015 to provide outcomes research to the addiction treatment industry. And shortly thereafter, when I was digging into all of the data about academic research, I discovered the research that showed that if you monitored the patients for things like depression, anxiety, trauma, suicidality, cravings, and so forth during the time they were in treatment, and reported that result to the clinicians in an easy to understand fashion, that patients got better faster during treatment. So I said, well, that's an obvious thing to add to what we're providing to our addiction treatment center clients. So we launched in March of 2016 2 different types of research. One is Insight Addiction, where we monitor patients while they're in treatment and report that result in real time to their clinicians to inform clinical care. And also Recovery 2020, where we follow up with the patients 1 month, 6 months, and 12 months post-treatment and are able to get, independent success rate data that the payers and prospective future clients need to know in order to determine what are the most effective treatment centers. We've been growing steadily since 2016. We now have certainly over 100 different treatment centers that are using our research. As I said, it's been growing really rapidly, and the majority of our clients do both the Insight Addiction during treatment and have us follow up with the patients post-treatment, because payers are starting to demand to know, what are your outcomes? Prove to me that you are providing good value to the members that we send for treatment at your locations. So fortunately, the whole industry is coming around to recognizing the importance of data. And what's so interesting to me is that this industry, up until recently, has been decades behind the rest of physical health care in terms of the use of data to improve treatment. And it's really exciting to see that change. I think, we've talked to so many hundreds of treatment centers who were like, absolutely, we want to do this, and we're going to start tomorrow. And what they don't realize is that they need to get started today. So we're doing a number of things to try and bring the industry forward faster. One of the things I'm really excited about is we're getting ready to announce the 2019 Excellence in Treatment Awards. Where
2019 what?
Excellence in Treatment Awards.
Oh, wow.
And we're going to do this through Conquer Addiction so that anyone who's doing outcomes, whether it's through Vista Research Group or if they're doing them internally or they're doing them through, some other research group, that they can present their outcomes, and we will be giving awards to the treatment centers with the best outcomes. So those that are in the top 5% of applicants will get the Conquer Addiction Gold medal winner for excellence in treatment. Those that are between 85 and 95% will get a silver award, and anyone in the top third of the group that applies and gives us outcomes research that has followed appropriate research methodology, anyone in the top third will get a bronze Excellence in Treatment Award. And so that's something that they can show to prospective patients, and they can show to payers and say, look, we're a leader in this industry. We have invested in doing outcomes research so that we can continue to improve and prove how effective our treatment is. So I'm really excited about that. We'll be announcing that later this month.